Right then, we will get going. Hello, everybody. Welcome to this webinar on responding to domestic abuse, lessons from Greater Manchester and Victoria, Australia. My name's Kate Brown. I'm Professor of Social Policy and Criminal Justice at the University of York, and I'm one of the co-directors of the Vulnerability and Policing Futures Research Centre, and I'm going to be chairing the webinar today. Some of you will be familiar with the centre's work. So we're based at the University of York and the University of Leeds, funded by the Economic and Social Research Council. Our work spans policing and social justice issues from criminal exploitation and modern slavery through to homelessness and mental health policing, youth violence. Domestic abuse is a major area of vulnerability policing in the UK and internationally, and so it's an especially important webinar today. Before we get into the research presentation and discussion, we just wanted to flag that we're delighted to be co-hosting a major international conference next year in partnership with the Global Law Enforcement and Public Health Association, or GLEFA. So the conference is called LEF, and you can scan through the QR code there to get all the details of the conference. This is in Leeds, West Yorkshire, 6th to the 9th of September 2026. And it's for practitioners, policymakers, as well as researchers from all around the world. There's lots of research on violence prevention, gender-based violence, sexual violence, intimate partner violence, and online forms of violence. So the call for abstracts is open. Registration is going to open really soon too. So please take a look, register your interest, and we hope to welcome you in Leeds next year. Today, then, we're especially pleased to be hosting this webinar featuring international cutting-edge research. As the UK struggles to get to grips with the government's commitments to halving violence against women and girls, it's an especially timely moment to look to places and countries that have been at the forefront of these efforts internationally. Drawing on qualitative interviews from a study conducted in the state of Victoria, Australia, and also in Greater Manchester, the UK. We have Professor Sandra Walkley, Dr. David Rowlands, and Dr. Larissa Engelman, who will be sharing their findings and reflecting on lessons learned. The team bring a wealth of expertise in this important cross-boundary area. Professor Walkley is Emeritus Professor at the University of Liverpool and leading international expert on violence against women and the interconnections between experiences of violence and the capacity for policy responses that are suitable. And previously, Sandra was Chair of Criminology at Monash University in Victoria, Australia, within the Monash Gender and Family Violence Prevention Centre. One foot in both jurisdictions in terms of the study that you'll hear from. Dr. Rowlands is an expert in complex drivers that are associated with vulnerability in the context of policing, focusing especially on identity and pro-social change. He works across a number of centre research projects, including the Minimum Policing Standard project, which explores what the public think the core functions of the police are and what they think police should do. Dr. Engelman is an expert in the role, value and culture of learning within the police and has worked on a range of projects in Police Scotland for a number of years. She works on centre projects including our Bradford place-based research and a project co-designing community resilience to online child sexual victimisation. The team's going to talk for about 35 to 40 minutes, and then there'll be time for questions and discussion at the end. Please do add your questions in the Q&A box as we go, and this means we'll have lots of engaging questions to open up the discussion towards the end of the webinar. So that's it from me, and team, it's over to you.
Thank you, Kate, for that really detailed introduction about us all. I've learned something about my co-researchers today too. And thank you for everyone who's taken time out to attend today. Yes, the purpose of our project is to look at the opportunities for taking the concept of vulnerability seriously, putting that at the forefront of domestic abuse. And most of our work is primarily focused on perpetrators and interventions. But as Kate has pointed out, some of you might be wondering about where the comparative element came from, or Kate's already explained that. Um, Kate Fitzgibbon, who was part of the team, and I both were appointed at Monash University in 2016, and we were appointed to their Gender and Family Violence Research Centre. Um, and that was just at the point at which the Royal Commission on Family Violence in the state of Victoria was reporting. And so the purpose of the centre was to kind of foreground for Monash University what could be learned internationally as the state of Victoria endeavoured to move forward with its agenda in that regard. So that's a little bit of contextual explanation as to why that particular comparative element. Okay, but first, perhaps we need to explain to you where we started from in terms of understanding our definitions and so on in this particular field. I'm not going to read every word that's on each slide that comes up because you'll get an opportunity to look at these in more detail after this event. But we've taken the definition of domestic abuse as a way of focusing what we're interested in. And we've taken to heart the complexity of domestic abuse. We've taken seriously that women are predominantly the victim survivors and men are predominantly the perpetrators. But also, we've acknowledged in the work that we've done that there is a growing recognition of same-sex of violence and same-sex relationships and women who use violence. The concept of vulnerability, some of you will already be thinking about, well, how have you dealt with that? We recognise as a team that vulnerability is hugely contested. Some of you may want to explore some of the online materials available from the state of Victoria. Vulnerability isn't a term that features in their policy responses. It's highly contested. But we wanted to take it on board in recognizing, the increasing presence of trauma-informed responses for victim survivors, that also perpetrators struggle with a range of different sorts of vulnerabilities, and the need for holistic responses in trying to make a difference in these people's lives. Interestingly, whilst it is contested, and I think both David and Larissa will concur with me saying this, that it's actually a very useful term for opening up conversations with practitioners because it gives a route into trying to work out where different organisations are at in making sense of their responses to domestic abuse. Okay, so moving on from that general discussion, I mentioned just a couple of minutes ago that both Kate Fitzgibbon and I joined Monash University the year after the Royal Commission into Family Violence. That commission took place after some very high profile incidents of family violence, particularly what captured public discourse was the murder of Rosie Batty's son by her ex-partner, and that came to be called the Batty effect in public discourse. She was nominated as Australian of the Year. But particularly telling in Rosie's response, in my view, to her experiences was her emphasis on this could happen to anyone. And it was that captured a public attention, as well as the fact that it was the murder of a child in public. And would you believe it, when they were at a cricket match? So you couldn't get anything that more impactful than drawing attention in the context of Australia in terms of touching on cultural values in entering public discourse. So the Commission was tasked to identify a range of things, but at its heart was making perpetrators accountable. That was one of the major themes of the Commission, and it made 227 recommendations. The report is available online. It's huge. If you're interested, you'll have a good afternoon reading it without doubt. So moving on. I thought it would be useful just to make clear when we're talking about this Royal Commission and we're talking about the commitment of the state of Victoria to implement all 227 recommendations, which it did and were signed off, is to just give you a feel for the costs involved. In the 2017-18 budget, the Victorian government committed to $1.9 billion to implement these recommendations. Now, in 2025, there were actually, I looked yesterday, $2 to the pound. In 2017 to 2018, it was about $1.60 to the pound. So this is big bucks. And that's a list of what was in the budget and what that money was going to be used to deliver. It's also important to remember that Victoria has a population of 6.5 million people. So somebody in the room was probably can do the maths quick enough to work out how much that is per head of population. And it covers the size of the island of Great Britain. Think about that. Just think about that for a minute. So what we have here in the context of the state of Victoria in terms of international learning is quite a substantial geographical area. So inbuilt in all of that, there's lots of stuff about rural areas and communication and outreach programs and so on, as well as a financial commitment per head of population. And just a further note, these are exclusive of what it was already costing the criminal justice system. So CJ costs come on top of that. And perhaps when we come to the last slide, you'll appreciate why I've made the effort to emphasize the fact that these things cost. They cost in terms of actually pounds, shillings, and pence, to put it in the UK context, but they cost in terms of getting organisations to shift. Right. Okay. So what we did, if we move on to the next slide, what we did in terms of the comparative element, in fact, and why Kate and I were involved in this project in the first instance, is actually we both had a bit of an input into the Greater Manchester's 10-year gender-based violence strategy. We weren't the only ones, but there is an acknowledgement in that gender-based violence strategy of looking to this big experiment in the state of Victoria to see what could be learned from that context. And again, you'll see from the GMCA strategy, there's a concern to actually take account of inequalities, to upskill workforce, to develop a culture of reflective learning, and also to actually try and shift the lens to a certain extent towards questions of accountability, towards actually taking the victim's voice into account and shifting that lens towards perpetrator accountability. Okay. So the aims were to reflect on the efforts in Australia, to examine the extent to which Greater Manchester's response to DA was going, how was unfolding, and the extent to which vulnerabilities featured in that, and ultimately to identify frontline practice, which we will end with, good frontline practice, which we'll end with this morning. You'll see here that it was, and as Kate mentioned right at the beginning, this was a qualitative study. Was field work conducted between 2023 and May 2025. In Victoria, we did a range of interviews with 39 different participants. All were central actors in the implementation of the Royal Commission. Again, qualitative interviews with GMCA, with key partners in their unfolding strategy, and a case study with practitioners in Salford. This work is also involved in a research visit of Greater Manchester practitioners to the state of Victoria and conference presentations, which have included presentations from GMCA and the Salford stakeholders. So that's very briefly an overview of where some of our observations have been generated and how they've been generated. Okay, So just briefly, something about the findings from Australia. From those interviews, and remember now we're 10 years on since the Royal Commission, there's been an overwhelmingly positive response to its findings, and its recommendations. It created an environment for change, and I can't emphasize that enough, particularly the introduction of specialist family violence courts. I perhaps should have said earlier on the preferred term in the state of Victoria for domestic abuse is family violence because it captures better the way in which Indigenous populations think about the impact of domestic abuse in the context of family life. So it introduced specialist courts, expansion of refugees, and I'm going to say something really personal here. If only one government would just do that in England and Wales for once. We've known how many refugees we've needed since the early 1980s. Nothing changes. Okay, you can put that comment aside. That was a very personal one. Dedicated family violence support services, known as the Orange Doors. These were units where a woman could report what was going on in her life, and that would give her access to all the support services just walking through the Orange Door. With the increased provision of men's behaviour change programmes. Okay. But here's the but, and there's always a but, talking to people. Post the implementation process of the 227 recommendations, many of our respondents talked about the implementation process as being hectic and about ticking boxes, the rush to tick off the recommendations, rather than there actually being necessarily all of the time evidenced cultural change. That implies a lack of consistency between services and particularly geographical areas. Remember what I said about the size of the state of Victoria. What might have gone on in Melbourne didn't necessarily reach out into other parts of the state. Limited availability of provisions for different kinds of community groups. So if you like, that informs our increasing recognition of violence in same-sex groups and so on. Questioning the sustainability of the implementation process, and that's where funding comes back in. Yeah. And how you might find something that works here, but then having the resources and the capacity to scale what works up to other sorts of contexts. The Victim Survivor Advisory Council was considered important, and that was actually one of the things that GMCA picked up on, but very limited in its role in how it could instigate change, and actually quite limited in its practice. One or two of our respondents commented on the unwillingness of some members of that council to engage with the police, for example, because of their historic poor experiences of policing. And there's a whole host of work around how you actually engage victim survivors in the policy change process. There are a whole host of questions and about the whys and wherefores of how you do that. 10 years on, increasing reference to reform fatigue, high turnover of the workforce burnout, and so on and so forth. And also one of the major things that people were fairly concerned about was the limited lifespan of what was called the Family Violence Reform Monitor. This was a role that was set up to monitor the extent to which the recommendations were being implemented successfully or not. And that role ended when all the recommendations had been ticked off. And that's really important, having some independent body that actually is there to look at the checks and balances of how far down the road this kind of policy has gone. And inevitably, the ongoing costs. Now, I emphasize, this kind of Victorian experiment has been there for 10 years. The time it takes for change is substantial. The demands for change and ensuring ongoing organisational change are actually huge. And that's resource intensive in the broadest sense on both the people, the organisations, and financially. Okay. Um, I think I hand over to Larissa now, who's going to talk about the initial stages from Greater Manchester. No, or is it David? It's David.
Yeah, it's me. Thanks, Sandra. Yeah, okay. So thank you, Sandra, for that. And so moving on now to the Greater Manchester findings, the Greater Manchester Combined Authority, running in parallel to the Australia work. And so in this work, we interviewed a number of strategic level leaders across the board, across various different statutory and third sector organisations, and from those interviews, five kind of key themes emerged. Next slide, please, Larissa. So the first thing to say is that there's a really strong foundation of multi-agency partnership working and a commitment to collaborative working across the area as well, and a realization that that's the kind of way forward for a holistic response to victims and perpetrators. And there's a really long-term vision matching the 10-year gender-based violence strategy, and obviously thinking beyond that as well. And that involves commitment across the board from statutory organisations as well as third sector providers as well. But it's true to say that the focus is very much victim survivor led. It's very much grounded in that, in improving access to services for victims, fluidity of journeys through the system, and protecting victims, and that's kind of the framing, as opposed to the secondary focus, which is on perpetrators, and the framing being, or the argument being, or the way to kind of change the narrative in terms of perpetrator vulnerabilities is really to sell it as a way of reducing victimization, and that's understandable. But there's also a family focus, and a growing family focus, which is grounded in a recognition that children living in the context of domestic abuse are victims in their own right, and that they have emergent needs that need addressing as well as part of that. So yeah, with a very much a kind of victim focused agenda, brings us on to theme two, which was the state of affairs in relation to an appetite for a vulnerability framing in terms of responding to perpetrators. So kind of addressing all those factors that may play into perpetration holistically. And here there was a range of views, but there was a real sense that one of the things that stood in the way of this approach was the political unpalatability of perpetrator vulnerabilities. In particular, the use of the word vulnerability as well in relation to people who are committing such heinous crimes. But fundamentally, that it creates this idea of being soft on crime, when there's a sense that actually what needs to be happening is the criminal justice system needs to be responding more swiftly and more stridently to domestic abuse offenders. But also, as well, there's a sense there's separation between victim survivor investment and perpetrator investment in perpetrators. So while they essentially mean the same thing, if you invest in perpetrators, you're investing in reducing victimization. Rather, there was a sense that if you invest more in perpetrators, you're taking away from investment in victims. And there was a real sense that the victim response wasn't really where it needs to be anyway. So that was a kind of a tension between those two approaches. Next slide, please, Larissa. The third theme was the recognition that domestic abuse is really complex. You know, there's in many ways there's as many forms of domestic abuse as there is disproportionate power relations in relationships. So it's really the most complex crime in that sense, that there's an infinite number of presentations, and this is kind of compounded by the fact that there's limited evidence base of what works. And for some providers, this kind of was a ready-made excuse as to why we might not take on a vulnerability frame work in responding to perpetrator needs. The fact that we don't know what works, so we're kind of at a loss. So there's a real need for kind of building up that evidence base. But the context of pilots, short-term pilots with poor evaluations that are then discontinued, it is something that's playing out very much in Greater Manchester as well. But the other complexities in domestic abuse, such as the differences in domestic abuse presentations in same-sex relationships, the cultural differences in domestic abuse and how that affects various factors, including reporting and responding, lesser known forms of domestic abuse, financial abuse, intergenerational abuse, care abuse, stalking, online abuse. But one of the key things that providers brought up, in particular the police and some perpetrator providers, was the unclear victim-perpetrator boundaries in some cases, and police not really knowing what they were responding to, where potentially a perpetrator's lying that they're the victim, and vice versa. So difficult to tease apart sometimes the dynamics that they're confronted with. But also cases of bidirectional abuse, and again, teasing apart those family dynamics. What's really going on here? Real difficulty for organisations responding to domestic abuse. Next slide, please, Larissa. Okay, so perpetrator vulnerabilities. So we really kind of prompted this discussion quite a lot because we were trying to get a handle on what the appetite was for treating vulnerabilities, for engaging in holistic responses for perpetrators. And what we found was there was a mixed response. Some practitioners used the term vulnerabilities in relation to perpetrators, others didn't. Whereas for victims, vulnerabilities was kind of clear framework across the board. For perpetrators, a risk framing was a lot more prevalent in terms of high risk, medium risk, low risk for repeat offenders, etc. So wide range of interventions available as well, which corresponded with different perspectives. So at one end of the scale, you had kind of patriarchal dynamics, rooted responses, and at the other end of the spectrum, you had organisations that felt that domestic abuse was a result of trauma-induced emotional dysregulation. And then in the middle, you had kind of organisations that were trying to address all kinds of factors in behavioural change programmes that integrated those two elements. And indeed, the accredited organisation was trying to marry up those factors to give a more integrative response. But some were still very, very resistant and cynical about a perpetrator vulnerability framework. And there's this quote here from an NGO victim support agency. I don't think addressing vulnerabilities of people who use violence will work. I mean, so when you get to 25, your behaviour is pretty much well set. And we always say that domestic abuse isn't because of alcohol, isn't because of drug use. The perpetrator is doing that because they can and he wants to. I don't see identifying vulnerabilities would make a blind bit of difference. So a very black and white way of looking at things, kind of devoid of nuance for some, is still kind of prevailing there. And again, just to reiterate, the perpetrator vulnerability framing was often positioned in opposition to victim survivor support. So the hard sell around addressing perpetrator needs reduces victimization was needing to be pushed through to kind of address that sort of that misnomer that they were competing in some way in terms of investment rather than both feeding into the same positive outcomes. Next slide, please, Larissa. But finally, it's true to say that across the board, a key factor was that everybody agreed that perpetrators need to be held to account. And this is in a context with a prevalence of non-admission of wrongdoing from perpetrators, a lack of taking responsibility, poor engagement, etc. So things that really threaten accountability. And this is compounded in some ways, some felt, by taking a vulnerability approach that might play into that mindset of not taking responsibility for crimes. One way that this was seen to be playing out was perpetrators justifying the behaviours based on the vulnerabilities and their needs. But another was that perpetrators, through their kind of facility for engaging with other services, could play the system. They could turn up to behaviour change programs on the pretense that they're addressing their behaviour, whilst really they're just doing it to kind of get access to the children, etc. And this was something that was again seen as problematic, but it presents a barrier to frameworks that seek to address perpetrator vulnerabilities. And there's a quote here from a Greater Manchester police representative: "You'll have perpetrators who manipulate the situation, manipulate the officer, claiming their own vulnerabilities at times. I couldn't have done this because I don't have it within me because I'm on this medication." So you've got your perpetrator who knows how to manipulate the situation, and you've got a victim who doesn't know how to manipulate the situation. I think we've got to support everybody to ensure that a change is made, but we've got to be very careful of perpetrators who effectively play the system. Okay, I think next slide is moving on to Larissa.
Thanks, David. Yeah, so I'll briefly talk about our Salford case study. So within our interviews with strategic managers, we also asked within Greater Manchester where there is good practice, where have the practitioners that we've talked to seen good developments, and Salford was an area that came up quite often during that discussion, and that had a few different reasons. So just for context, Salford is a city in Greater Manchester with a population of about 129,000 people. And it's been through quite significant changes since 2015, which started kind of more with the youth service side of things, where they wanted to expand the provisions for young people. But within that, they saw very often, as we've already talked about today, that children living in the context of domestic abuse are experiencing a lot of negative impacts that need to be addressed in a kind of family context. And for that, you need to address domestic abuse as a whole. So in 2019, there was a business case that went in to develop a lead provider model. So it was an invest-to-save business case that led to the development of a lead provider model that was called Save in Salford, and they were then the commissioned service to provide a single accessible front door service, mainly for victim survivors and children and young people, but it also includes the perpetrator support within that. So they have different initiatives, which includes a service particularly for children and young people in the context of domestic abuse within this front door service. And you can see some of the detail of that in a report that we're going to bring out soon as well. So I'll just go through some of the themes for this. Right. So I want to begin with the views that we've received from victim survivors of domestic abuse. So we were very lucky to engage with 15 victim survivors, all female in our case, and all who have been in contact with Safe in Salford and received support through Safe in Salford and their aligned organizations. And one thing that became very clear very early on by almost all victim survivors that we talked to is that a major barrier of them not seeking support was them not knowing about the services that are actually available for them. So that includes housing, financially, mental health, support for the children, and criminal justice wise as well. There just wasn't that knowledge about, well, what will actually happen and what happens to me and what can I do and where am I going to go and how am I going to support my children? And that was a massive barrier. That was in addition to kind of the public narratives that were still going around and that are still going around about, you know, I might go forward, but what if they believe the perpetrator, and what if, you know, nothing's going to happen and then I've agitated the person who's already abused me and then I need to go back into that house and it's going to happen again and it's going to get worse. So the trust in the system to actually help them wasn't often there. But when we got into the discussion about which services they engaged with and how has it been since, actually that has shifted. So that engagement with Safe in Salford and the support that they've received, particularly from independent domestic abuse, domestic violence advocates, IDVAs, really changed that perspective. And they had a lot of positive things to say about the provisions that they've received and just the support that was available, even just to put things into storage, that the local council would, give free storage for people to put stuff in there whilst they're in refuges and things like that, that they didn't know about before. And that really helped to change that perception. But it did mean that a lot of the victim survivors that we talked to didn't come into the service until emergency services became involved. And that meant that the abuse got so severe that it was either the police or the ambulance that had to act and had to take the person, the victim survivor, and possibly the children out of that situation. So the abuse actually got quite severe before they sought out support or were put into that support situation. And then lastly, also victim survivors sometimes felt that the general practitioners that are not domestic abuse specific, so social workers, for example, were named as some practitioners who often also didn't have the knowledge about what was available in terms of domestic abuse specific support in the area. So there was a piece around knowledge for practitioners as well, not just for members of the public and possible victim survivors. The second theme, and kind of reflecting why we found Salford as a good practice case study, was similar to what we found in Greater Manchester as a whole, that there was a really good infrastructure and there was a shared ethos about how domestic abuse is supposed to be addressed, how organizations thought about domestic abuse, and in Salford in particular, this kind of think family approach. So looking at victim survivors, but also looking at the person who's used violence and children and other family members that might be involved in that scenario. So it was often seen as a trailblazer. There was practitioners that were frontline practitioners in Salford, but also other areas of Greater Manchester. And in comparison, they found the connections and multi-agency framework in Salford more beneficial than in some of the other areas of Greater Manchester, just because that shared ethos was there. So it was more easy to talk about domestic abuse and find shared solutions and work together to have that collaborative, connected service network. But as ever, even though they now have this single front door provision, there's still a kind of short-termism of the investment. So that is initial funding to commission Safe in Salford. There's no kind of knowledge how long that will continue and if it will continue. And then the services within that, so particularly for some of the perpetrator programs, there was a perpetrator program called Drive. That was a 12-month program that a lot of practitioners that we talked about really positively, because it gave time to build a relationship, to address some of the behaviors, but also other vulnerabilities. And it was a bit longer term. That didn't receive follow-on funding, and it was quite a short kind of pilot almost, whereas that was then a different program came in that is only 6 months now. And again, they don't know how long that's going to stay. So there's always that kind of moving on, as that quote there is trying to address. There's a bit of funny money for a short period of time to do a pilot. And then, sometimes it might not be evaluated appropriately. And I know we'll touch on some of the monitoring issues and things again at the end, and some things that there's that learning from Victoria and Australia. But, if there is an evaluation and there's positive response, then there needs to be follow-on funding to keep that going. And that's not often there. Moving on to theme 3, there's as is Greater Manchester wide, but when we went into the frontline practice, from strategic into frontline practice, we could really see that there was a few issues around thresholds. and just the definitions about need and who gets priority and risk assessments and how they work between organizations, that didn't always quite work in favor of supporting a holistic response for domestic abuse cases. So, for example, this housing practitioner was talking about, the duty owed to a victim survivor is, of course, higher than that of a perpetrator, and that actually a perpetrator will have a lot of issues finding support to get housing unless they have, for example, a diagnosed mental health issue, or they have the children are in their care and they need housing to take care of the children. But then obviously if the perpetrator doesn't have housing, the likelihood of them going back to the victim survivor or to another woman to find, a place to stay, then that might increase risk incidentally for that person. So there's a lot of kind of relations between services where the thresholds don't often work in favor of solving the domestic abusive scenario and situation that people are in, and that can lead to delays in fragmented service user journeys. When it comes to then the complexities of perpetrator support, and David has already touched on it, and Sandra as well, there's a lot to be said. And for myself, coming not from a domestic abuse research background, when I went into this, I don't think I quite realized just how complex this domestic abuse topic and domestic abuse situations and the response to domestic abuse is. And then even more so when you look into perpetrator support and perpetrator behavior change. It's very complex. We called it a messy business here. And that really requires trusting and experienced service networks. So it needs really experienced, knowledgeable practitioners who can work well with each other and check with each other and keep each other up to date about what is happening at one end of the service provision that might impact the other, as I said, kind of in the previous theme. Whereas there's a bit less contention and kind of complexity when it comes to early intervention and prevention work. Certainly in prevention work, everybody was in agreement that that's key for the kind of changing the narrative piece about learning about, firstly, what domestic abuse is, but also about just changing it from happening in the future. So talking about the role of masculinity and what a healthy relationship is and consent and, all of these concepts, get them out early into, primary, secondary school, talk to young men about, what does it mean to them, and talk to young women about what does it mean to them, and bring in people together and talking about this. And there's a lot of work in Salford that is going on in that space and in Greater Manchester as a whole. And of course, in many countries now with the VOC agenda as well, that is helping with that. And that is, I think that is almost the kind of easier way to get in, but that obviously doesn't address the high risk, high harm offenders that we already have, and then how to address what's already there. And for that, we've seen that within Salford, certainly there's been that shift to trauma-informed perpetrator support interventions that are quite holistic in the way that they're approached. So it's about helping perpetrators to acknowledge the harm that they've caused and take responsibility for that. And that can take quite a long time. So the readiness for someone to get to that point to be able to do that might not be when it happened and when they start engaging with, the criminal justice system and that process starts. And that can be difficult because our systems tend to be something happens, you get put onto this program or you get access to this program now. And if you don't engage now, then what happens next? So there's a bit of sequencing that needs to be thought about, that they're trying to think about within Salford and other areas where, maybe it's about, like this perpetrator support service provider says here, they might not be ready for some of the groups. They might have other issues around drug and alcohol, homelessness, and their lives are a bit too chaotic to even start that discussion about you know, acknowledging the harm that they've caused, because there's so much other things going on. So it's about how can we address some of the other things, make their life a bit more stable, to then start talking about what else is happening, and also working with the victim survivor at the same time. So they have a lot of programs where the victim survivor support service works with the victim survivor at the same time as with the perpetrator. Everybody knows that this is happening, including the victim survivor, and they have to agree to it, of course. But then they can kind of make sure that for victim survivors where, for example, there's children involved and they want to stay together, or they might want to get back together in the future, they can kind of provide that holistic support on both ends. To address some of the vulnerabilities and some of the acknowledgement that needs to happen to prevent things from happening in the future. And then the last one for Salford, as ever, and as Sandra mentioned as well, things can move in the right direction, and certainly from what we've experienced in Salford, we think things are moving in a very positive direction, but there's always a but. And there is a bit of gaps that have been identified by the frontline practitioners, but also by the victim survivors that we were able to engage with. So one of which was, there's a kind of very young workforce that is coming in now that is maybe not young by age, but also young by age, but also just young in experience in the domestic abuse sector, and might therefore not have the knowledge and skill to address some of these really, really complex cases of, like David said, you know, a perpetrator who might know how to play the system and play the worker that they're engaging with. And you need that confidence and competence to be able to handle these situations. There's still a bit of a lack of evidence around the knowledge and levers for engagement for perpetrators. So how, you know, how do we identify what a perpetrator needs, and how to address that, and then gaps in knowledge around domestic abuse as a whole, and certainly for service availability in particular, not just in Salford, but also other areas. I'll leave it there. There's a few conclusions here that I wanted to hand over to David just to finish off.
Okay, yeah, just briefly, these preliminary conclusions. Just to summarise, domestic abuse is a highly politicised subject, which negatively impacts investment for people who use violence, and there's a real need for building the evidence base to give that more grounding as well. Early intervention to encourage help seeking and openness about vulnerabilities which may drive domestic abuse is important to change the tide, and that work's starting to happen quite a lot, and it needs continued investment. By the same token, long-term investment, monitoring and political bravery are central to requirements for addressing the causes of domestic abuse. So it does need people to stand above the parapet, and in particular in relation to perpetrator interventions and kind of face the public wrath, if you like, of that in you know, in the service of improving outcomes, and ongoing discussions about how to expand on this work and encourage learning across jurisdictions as well. So the work that's in Greater Manchester that's influenced by Victoria, Australia. I mean, those dialogues, those reports, etc., are really fundamental to improving things across the board. Okay, and I think we're going to move on to Kate Brown facilitating questions and discussion now.
Thank you so much, team. Yeah, you covered such a lot of ground there. I'm fortunate to have heard these findings in a range of settings, and it's always especially fascinating to hear from the Commission of Victoria and all of the extensive work there. I think resourcing just comes through as such a strong theme. And I think noting your personal reflections on refuges, Sandra, I think before I worked as a researcher, I was a service manager for Leeds Women's Aid, providing refuge provision. And just to say, I can certainly relate to that in terms of how long that has been an issue for. That was 20 years ago, you know, still the same struggles. So I know many of you have extensive expertise in this area. Keen to hear your questions and comments. So please do pop those into the Q&A box, and then I'll feed them through to the panel. We've still got a few minutes before we need to wrap up. I'll start with a warm-up question, Chair's privilege, while you're populating the Q&A box, participants. So I just wanted to ask about the policy transfer and the way that quite often in social policy, government policy, we look to other countries, we see their shiny policies, and I think, you know, we try and borrow them over, and you kind of alluded to some of the buts in that process of policy transfer, and just wanted to ask about how you see the opportunities and also some of the risks in that policy transfer process and the learning.
Yeah, I think it is interesting, and the whole kind of spectrum of policy transfer practices in and of themselves are interesting. There are opportunities for learning there, but as long as you take those opportunities in the context in which they were generated, and I think that's really, really important. And context is in terms of you know, both resources, which is featured in this presentation by all three of us, the need for resources, the need for political commitment. I love the phrase, it wasn't mine, but the bravery of political leaders to really commit, because it does take resources, but it also takes time. One of my, again, speaking personal frustrations with policy responses in this area is that we too quickly go for knee-jerk reactions to a particular incident or a response to a particular interest group. And that isn't the way to go. I mean, one of the big things to learn from Victoria is their efforts to do actually engage in this whole of system change that puts accountability and the perpetrator at the centre. I mean, I think Larissa's reference to education is really important there, because one of the key, if you like, initiatives that have come out of the state of Victoria is an organisation called Respect Victoria, which actually has been developing, you know, respectful relationship packages in schools and so on. And that's been evaluated by colleagues at Monash University. So all that full spectrum commitment, without underestimating the demands it makes on organisations for change, and recognizing that organizations don't like change much, no matter how much their leaders might vocally commit to change. There are, if you like, intransigent, system resistant practices to change. I'll give risk and risk assessment as a classic example of one of those areas in which that happens. And that requires time. It requires constant work and time over time, and recognizing that not all of these organizations share the same common goal. So you've got to work at that. That's one of the things that's come out of my listening to Larissa on Salford this morning. You've really got to work at it. And it takes time. It takes time. It takes money. It takes political bravery. I think those are the things that I would say. So yeah, look for policy transfer, look for lessons from elsewhere, but look at it carefully, and don't necessarily get distracted by the high level. Oh, this looks good. This will win me some votes in the next election. You know, we've really got to stop doing that in this field of work.
Timely reflections in the current context. Thank you so much. Yes, please do come forward with any Q&A that you may have. So Mickey, thank you. You have dropped in some news about new resources that I think we might be able to share. I'm looking to Nathan here, who's our communications and engagement officer who's putting the webinar together. Is happy to share that as a resource for people who might be interested. And then, yeah, any other questions, keep them coming. I do have more questions that I can ask away on. You're all very quiet at the moment, and then there'll be a flurry of activity towards the end, I'm sure. I wanted to know more. I know you covered so much there, but I was keen to hear a little bit more about the Victim Survivors Advocacy Council, if possible. And you kind of alluded, Sandra, to the fact that there were a whole load of questions and issues which are raised by that, and just wondered if you wanted to say any more on that, the learning from that.
Yeah, and in the sense, on the positive side, this was a kind of a first, particularly in the Australian context, to establish that council. It was one of the recommendations, but they never kind of worked out where that council would sit in terms of influence on policy. It was almost as if they became an afterthought, So you go, oh, we'll go down this road. Oh, let's just see what the council thinks about that. And actually, the model might be to incorporate the council along the journey. Yeah. And then you've got other added dimensions to that about, who got invited to participate, why they got invited, who was listened to, who wasn't, why were they listened to, and that whole arena, and people who write about and the writing on that arena has just mushroomed in the last 10 years. So my general comment sitting here now would be just to think carefully about the structural relationship, and about, that those questions about who gets listened to and why are really, really important,
Absolutely.
because that can pose dilemmas. It can be positive, but it can also be negative. There was some research published on listening to victim survivor voices that kind of ended up with the conclusion, yeah, the most effective voices that have been listened to are the white heterosexual middle class women. Yeah, just putting it's crudest. That's one of the dangers. So
thanks, Sandra. Can I just ask a final question before we wrap up? Because we've had a big and important question that's come in, a couple of questions, but I'll take the one that came in first. How best can a policing response be transformed, in your opinion? Big one to end on.
David, Larissa, do you want to go?
I can say something a little bit about it, and then maybe Larissa will have something to add. But one of the things that did come out was the lack of continuity with the police service, and from some of the other work I've done with the minimum policing stuff, some of that seems to be the process of response, kind of to neighbourhood, and the follow-up and the communication piece there and the dialogue. But how that's kind of translating into the victim experience is, it's as if nothing's known about the case every time, and it's looking to the victim very much like the police are taking the side of the perpetrator or dropping the ball. There was cases of what appeared to the victim like they'd lost the evidence and things like that. Now, obviously, we didn't speak to the police officers involved in that particular case, but that's certainly the victim experience there was quite chaotic of the police.
Thank you. Thanks. Go on, Larissa.
Just quickly to say, I mean, we've seen positive developments with, domestic abuse matters training, and that includes not just domestic abuse specific officers. So I think it's making sure that that message doesn't stay with particular teams, but it goes across the force, because it's that first point of contact that can make a massive difference for a victim survivor of domestic abuse and the families that engage with the police. So I think it's getting the message out to all police, and the police can't do it by themselves. It's a joint effort with other organizations and other people involved in the response.
That's always something that comes through time and again in our studies at the Vulnerability and Policing Futures Research Centre. So that's probably a good note to end on, because we're at time. I'm sorry we ran out of time for other people's questions. We've also had good contact from Jonathan at GMP, which we can pick up following the webinar. So yeah, just leaves me time to say a huge thank you to our panel today for sharing all of their insightful research. Thank you to you as delegates for coming along and engaging with the research and taking it off into your own areas of work. And then a final massive thank you to Nathan Capstick, who puts these webinars together and makes it all run so seamlessly. And thank you, Nathan. And yeah, we can leave it there. Thanks a lot, everybody. All the best.